It's being called a major milestone in testing for COVID-19. The FDA has now authorized the first over-the-counter, fully at-home test to determine whether a person is infected with COVID-19. Mandy Gaither has more on how it works in today's Health Minute.
It's a first in the fight against the coronavirus. The Illume COVID-19 home test is now backed by the FDA for anyone 2 years of age or older. It's the first COVID test that can be used completely at home without a prescription. The test uses a nasal swab, but doesn't go as far back as a swab you'd get from a trained healthcare provider. It has an analyzer that connects with an app on a smartphone to help users conduct the test and decipher the results, which come back on the smartphone. The FDA says the test correctly identified 96% of positive samples and 100% of negative samples in those with symptoms. In a statement, FDA Commissioner Dr. Stephen Hahn says by authorizing a test for over-the-counter use, the FDA allows it to be sold in places like drugstores where a patient can buy it, swab their nose, run the test, and find out their results in as little as 20 minutes. By expanding access to testing, officials hope to lower the burden on labs and supplies and give more options to Americans. For today's Health Minute, I'm Mandy Gaither.
The FDA says just like other antigen tests, the small percentage of positive and negative results from this test may be false. So the agency advises those who test negative but have COVID-like symptoms to follow up with their health care provider.